1. Understanding pneumonic plague, what you need to know. 2. Pneumonic plague in modern times, a reminder of the Black Death's legacy. 3. First pneumonic plague death in Arizona since 2007. 1. Understanding pneumonic plague, what you need to know. A deadly resurgence, uncovering the truth about pneumonic plague. A recent, shocking death in Arizona has brought the pneumonic plague back into the spotlight, sparking widespread concern. But here's the alarming part. This isn't the bubonic plague of medieval fame. It's a far more contagious and deadly form that can spread from person to person. To separate fact from fiction, we consulted with Dr. Lena One, a renowned emergency physician and clinical associate professor at George Washington University. Let's dive into the world of pneumonic plague, exploring its symptoms, transmission, diagnosis, treatment, and most importantly, how you can protect yourself. What is pneumonic plague, anyway? Pneumonic plague is one of the 3 forms of the plague, caused by the bacterium Yersinia pestis. Unlike its more infamous cousin, bubonic plague, pneumonic plague targets the lungs. But here's where it gets controversial. While bubonic plague is typically spread through infected rodent fleas, pneumonic plague can be transmitted directly from person to person via airborne droplets. Yes, you read that right, this plague can spread through coughing. How do you contract pneumonic plague? The route of infection varies depending on the plague type. Bubonic plague usually originates from an infected rodent flea bite, which can then progress to septicemic plague if left untreated. Pneumonic plague, however, can develop from either bubonic or septicemic plague if the bacteria reach the lungs, or through direct inhalation of infected droplets. And this is the part most people miss. Cats and other animals can contract the plague by eating infected rodents or through flea bites, potentially passing it to humans. Symptoms. Know the warning signs. All 3 plague forms share common symptoms like fever, headache, chills, and weakness. However, each has distinct characteristics. Bubonic plague * 1 or more swollen, painful lymph nodes, buboes. Septicemic plague * multi-organ failure and total body shock due to bacterial spread. Pneumonic plague * rapidly progressing pneumonia with shortness of breath, cough, and chest pain. Is plague common? Should you be worried? ***. The reassuring truth * plague is extremely rare, with only about 7 human cases reported annually in the United States, mostly in northern Arizona, New Mexico, southern Colorado, California, southern Oregon, and western Nevada. Globally, most cases since the 1990s have been in Africa, particularly in the Democratic Republic of Congo, Madagascar, and Peru. Diagnosis and treatment. What you need to know. Diagnosis is made through laboratory testing of blood, sputum, and swollen lymph node parts. The good news * effective antibiotic therapies like gentamicin and fluoroquinolones are available. Prompt treatment is crucial, as the case fatality rate can soar to 30% to 100% if left untreated. Vaccine availability, a point of contention. Although a vaccine was once authorized for high-risk individuals, it's no longer available in the U.S. due to the disease's rarity. Spark for debate * should resources be allocated to develop new plague vaccines, considering its low incidence rate? Reducing your risk. Practical tips. For those in western U.S. states where plague has occurred. 1. Avoid wild animals * don't handle wild rodents or touch sick/dead animals. 2. Prevent rodent infestation * store pet food securely and keep your home surroundings clean. 3. Avoid flea bites * wear protective clothing and use DEET-containing repellents when outdoors. 4. Pet safety * keep pets away from wild rodent areas and monitor their health, seeking veterinary care promptly if needed. The bottom line * while the recent Arizona case is a sobering reminder of pneumonic plague's existence, the risk to the general public remains low. We want to hear from you *. How concerned are you about the pneumonic plague? Should more resources be dedicated to developing a vaccine? Share your thoughts in the comments below. 2. Pneumonic plague in modern times, a reminder of the Black Death's legacy. The Black Death, a name that sends shivers down the spine, is often relegated to history books, But a recent tragedy in Arizona serves as a stark reminder that this ancient scourge is not entirely a thing of the past. A resident of Coconino County, home to the city of Flagstaff, succumbed to pneumonic plague, a severe lung infection caused by the bacterium Yersinia pestis, the same culprit behind the medieval pandemic. This incident, though rare, highlights the persistent presence of plague in certain regions, including the United States, where it has quietly lingered for over a century. But here's where it gets controversial. While plague is indeed rare in the U.S., with the Centers for Disease Control and Prevention, CDC, reporting an average of only 7 human cases annually, its existence in modern times raises questions about public awareness and preparedness. David Wagner, Executive Director of the Pathogen and Microbiome Institute at Northern Arizona University, reassures the public that the risk is minimal, stating, "It's more important that you put your seatbelt on going to the grocery store than it is to worry about plague in the western U.S." Yet, the recent fatality prompts a deeper dive into how this ancient disease continues to survive and occasionally strike. Plague is primarily a disease of rodents and their fleas. The cycle begins when an infected flea feeds on a rodent carrying Y. pestis, then transmits the bacterium to another rodent or, in some cases, to humans. This natural cycle has sustained the disease for thousands of years across the globe. And this is the part most people miss. Plague has been endemic in rodent populations throughout the western U.S. for over a century, particularly in states like New Mexico, Arizona, Colorado, California, Oregon, and Nevada. It's not a matter of if, but when, these bacteria find their way to humans. The disease manifests in different forms: bubonic, pneumonic, and septicemic. Bubonic plague, characterized by swollen lymph nodes called buboes, is the most common. If left untreated, it can progress to pneumonic plague, which affects the lungs and can spread from person to person through coughs or direct contact. Septicemic plague occurs when the bacterium enters the bloodstream, often as a complication of bubonic plague. Here's a thought-provoking question. Could modern hygiene and antibiotics truly prevent another large-scale pandemic? Or are we underestimating the resilience of this ancient bacterium? Pets, particularly free-roaming ones, can also play a role in transmission. While rare, fleas from infected rodents can hitch a ride on pets and enter homes. Cats, being more susceptible, can develop pneumonic plague, posing a potential risk to humans. This raises another point of contention. Should pet owners in endemic areas take extra precautions, or is the risk too negligible to warrant concern? Symptoms of bubonic plague include fever, headache, chills, fatigue, and swollen lymph nodes. Pneumonic plague, on the other hand, presents with respiratory symptoms like cough, chest pain, and difficulty breathing. The good news is that plague is treatable with antibiotics if caught early. Untreated bubonic plague has a mortality rate of 30 to 60%, while untreated pneumonic plague is almost always fatal. This begs the question: are healthcare providers in endemic areas adequately trained to recognize and diagnose plague, or could delays in treatment lead to more fatalities? Globally, Madagascar stands out as the country with the highest number of plague cases, accounting for about 75% of the global total. In the U.S., the disease's spread has been somewhat contained to the western states, though the exact reasons remain a mystery. Researchers like Wagner have been studying plague-infected fleas from prairie dogs for over 25 years. Yet the specific rodent species maintaining the disease in the wild are still not fully understood. Here's a counterpoint to consider. While hygiene and antibiotics have undoubtedly reduced the threat of plague, the bacterium's ability to persist in wildlife suggests it could re-emerge under the right conditions. As Wagner and his colleagues continue their research, one thing is clear. The Black Death may be dormant, but it's far from dead. What do you think? Is the risk of plague something we should be more concerned about, or is it rightfully relegated to the realm of rare diseases? Share your thoughts in the comments below and let's spark a conversation about this ancient yet enduring threat. 3. First pneumonic plague death in Arizona since 2007. In a shocking turn of events, a resident of Coconino County, Arizona, has succumbed to pneumonic plague, marking the first fatality from this disease in the area since 2007. Health officials have clarified that this tragic incident is not linked to a recent die-off of prairie dogs in the vicinity, which may also be associated with the plague. On July 11th, health authorities confirmed the death, which occurred in a region that includes part of the Grand Canyon National Park and is situated north of Flagstaff. Pneumonic plague, a serious lung infection, is quite rare among humans, with only about 7 cases reported each year in the United States. Unlike the bubonic plague, which devastated Europe centuries ago, pneumonic plague can be transmitted through the air via respiratory droplets. Both forms of plague are caused by the bacterium Yersinia pestis. However, while bubonic plague is typically spread through bites from infected fleas or contact with contaminated materials, affecting the lymph nodes, pneumonic plague leads to pneumonia and respiratory distress. The individual who passed away, whose personal details remain undisclosed, was admitted to the emergency department of Flagstaff Medical Center and tragically died on the same day. Northern Arizona Healthcare, the hospital's operator, stated that despite receiving appropriate initial care and attempts at resuscitation, the patient could not be saved. This incident is particularly noteworthy as it represents the first recorded death from pneumonic plague in Coconino County in nearly 2 decades, although it is not the most recent case of plague in Arizona. Since 2006, the state has documented 7 cases of plague, with the last death occurring in 2007 after an individual had contact with a deceased animal infected with the disease. According to the Centers for Disease Control and Prevention, CDC, approximately 7 human cases of plague are reported annually across the nation, with only 15 deaths attributed to the disease over a 23-year span starting in 2000. Most of these cases have been observed in rural western areas. The CDC explains that Yersinia pestis naturally cycles among wild rodents, and while most infections in humans occur through flea bites, exposure to sick pets, particularly cats, can also lead to infection. The recent death has coincided with an investigation into a sudden die-off of prairie dogs northeast of Flagstaff, which may be linked to the plague. However, county officials have stated that they do not believe the human fatality and the prairie dog deaths are connected. In light of these events, health officials have issued recommendations to minimize the risk of contracting the plague. These include avoiding contact with wild animals, steering clear of sick or deceased animals, refraining from camping near rodent burrows, and not sleeping directly on the ground. They also suggest using insect repellent and ensuring that the cuffs of pants are tucked into socks. Coconino County health officials have indicated that the likelihood of human-to-human transmission of pneumonic plague is low, with the last recorded instance occurring in Los Angeles in 1924, according to data from the National Institutes of Health, NIH. Despite this, the symptoms associated with the Black Death, which earned its name from the dark spots that appeared on infected individuals, are still relevant today. Health officials in the U.S. note that symptoms of plague typically manifest within 8 days of exposure and may include fever, chills, headaches, weakness, muscle pain, and swollen lymph nodes, known as buboes, which are most commonly found in the groin, armpits, or limbs. The timing of this human plague death alongside the prairie dog die-off has raised alarms. Plague is one of several diseases endemic to the southwestern United States, alongside West Nile virus, hantavirus, and rabies. Trish Lees, the communications manager for Coconino County, informed the Arizona Republic that the exact number of prairie dogs that have died remains unknown. This situation underscores the importance of public awareness and preparedness regarding diseases that can emerge in our environment. What are your thoughts on the measures being taken to prevent the spread of such diseases? Do you believe more should be done to educate the public about the risks associated with wildlife interactions? Share your opinions in the comments below.